By completing the portfolio projects, I was able to learn about everything that goes into creating effective professional writing, such as being aware of the audience, being clear and precise, and using scholarly sources to back up my information. I also learned how to create an annotated bibliography for the first time. For the first course outcome, I was able to determine the format of the paper by analyzing who I was writing the paper to and why. I was able to use healthcare terms and talk about neonatal abstinence syndrome without having to worry if the reader would understand my writing or not, because I was writing to an experienced head nurse. It was also important for me to sound as educated as possible for her to even consider my proposal. The next course outcome was easy because the portfolio project itself was to create a clear and concise computer-generated memo. Another course outcome that was met was finding scholarly documents to include into the paper. This involved analyzing the documents to make sure they were educational and up to date. After finding sources to use in my paper, I was able to directly quote them in the paper and cite them as well. For the institutional outcomes, I was able to use current technology and resources to find and evaluate information to back up my proposal. Throughout this course, I learned a lot that will help me be a dependable employee. I will know how to properly communicate in the workplace while being aware of cultural inclusion. Being able to properly communicate will allow my coworkers to see me as a dependable and reliable worker, as well as with my patients. An important workplace capability I learned throughout this course was communication. Communication is extremely important as a nurse. If the wrong information is passed on, or the lack of it, it can lead to horrible mistakes in the healthcare field, such as medication mistakes.